Alright, so how is meningitis diagnosed, and what labs and tests are done when meningitis is suspected? So, as many of you may know, the lumbar puncture is the gold standard for meningitis diagnosis. The lumbar puncture extracts a bit of cerebral spinal fluid, and it can be used to measure cerebral spinal fluid pressure, along with other contents in the cerebral spinal fluid, such as protein, glucose, and white blood cells. And the defining factor for what type of meningitis is present is in bacteria. The cerebral spinal fluid will be high in protein, low in glucose, of course, because the bacteria is eating the glucose. It's feeding off of that. And there will be neutrophilic pleocytosis, so excess neutrophils. And in viral meningitis, the protein levels will be normal to slightly elevated, along with normal glucose levels and lymphocytic pleocytosis, which is excess lymphocytes. And when it comes to diagnosing bacterial meningitis, a bacterial culture and gram staining of the cerebrospinal fluid are key diagnostic tests. Gram staining allows for rapid identification of the exact causative bacteria, ensuring that appropriate antibiotic therapy is utilized. Another diagnostic test is cerebrospinal fluid PCRs. This is particularly useful for diagnosing viral infections, such as herpes simplex virus, enterovirus, and varicella zoster virus. So a PCR is much more sensitive than the other diagnostic tests. And for this reason, it can also be used to detect viral infections in immunocompromised patients. And it can also help identify bacterial infections in cases where cultures are negative or inconclusive.